So when it comes to looking after your children's teeth, one of the very first things that you need to understand is that you, as the parent, father or mother or caregiver, you are the one who is causing or preventing problems in that child. Might sound harsh, but it's the truth. Children are born sterile. They get their bacteria from in their body, in their guts, in their mouths from their parents. So looking after your own health and your diet and controlling the bad bacteria in your mouth is the first step to look after your child. Second point, specifically about kids, don't give them dummies beyond 6 to 9 months of age. Thumb sucking is something that's harder to control because the thumb is always there. But a dummy is something you can stop. You just throw it in the bin, it's gone. Because dummies do damage faces and jaws. First few months, totally fine. But once they start on a diet, on food, start them with things that are not sweet. So don't get them used to the sweet stuff. Never, ever, ever give a child juice until they're grown up enough to go to parties and have juice at a party or something like that. That's fine. Definitely water, and we started with our daughter with water from day one actually, just with a little spoon, later with a cup, so it's milk obviously and water, breast milk and water, and then bottle and then water, and then food and water. Obviously brushing their teeth, I would start when they're little babies with a piece of gauze wrapped around the finger and wet in water, or ideally, more ideally, water with sodium bicarbonate, baking soda, just a teaspoon in the water, dip it in that, and rub their gums and their tongue and their cheeks. When they're a year old and they have some teeth, and you swap that little gauze to a toothbrush, they won't fight you because they're used to it. And then don't trust them to clean their own teeth well by themselves until they're 7 or 8. So you brush your teeth, they brush your teeth with you, but they don't know what they're doing, they're just playing. So let them do that, and then you take the brush, put them on your lap, or make a game out of it, and you brush their teeth. In kids, it's actually quite easy to use floss if you're using it for them. So cleaning between their teeth again is quite important from a very early age because you won't get everything out with a toothbrush. Anywhere between 5 and 10, it's an ideal time to assess what are the habits that child is doing. Are they developing properly? Is the face developing properly? Is the jaw developing properly? Are they nose breathing and all that? So it's not just about looking at the teeth and whether they're healthy or not. That's important. It's about the whole person, their posture, their behavior, the position of their jaws, because a lot of these things can be fixed very easily in kids with little plates and trainings and little exercises. You can fix a lot of that, which later on might be non-fixable or need extensive jaw surgery, facial surgery, which is very expensive and very painful and doesn't always work anyway, or braces for 3 or 4 years or something like that. All that can be prevented. So even if they do end up needing some braces, it's for 6 months, so just a little tweak. Without having teeth out, everything else gets caught earlier. That's what we did to my daughter, and that's what I would do to any child.